Yo, 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 it's your boy Peter, and today we will be talking about malaria. And this is actually going to be a very brief and short overview of malaria and the symptoms that it comes with. So, malaria is a disease which is transmitted by the bite of the female Anopheles mosquito. And actually, malaria itself is a parasite that consists of four forms, and they include Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. Out of these four Plasmodium species which cause malaria, there are two which are the most common forms, and it's Plasmodium falciparum and Plasmodium vivax. Plasmodium malariae, which many people might think would cause malaria because of the name that comes with it, is not actually a very common form of malaria, and these probably are less severe. And well, this disease occurs in the subtropical and tropical regions because these regions have very high temperatures, very warm temperatures, and they favor the life cycle of the mosquito and also favor the development of plasmodium of the protozoa as well. And it should also be noted that these regions of the world have issues with proper sanitary conditions, which would also favor the growth of different insects and different parasites. So, this is actually a major problem in these regions. So, how does malaria then infect the human? Actually, it is very, very important to know that the mosquito itself does not produce malaria, but it is important in the transmission of malaria. So, what happens is the mosquito bites an infected human that has the gametocytes. These are the sex cells of the Plasmodium protozoa. Then it develops in the mosquito to produce sporocytes. So the saliva of the mosquito is infected with a lot of sporocytes. Then the mosquito goes to an uninfected human and bites the uninfected human. While it is sucking blood from this uninfected human, it injects this malaria parasite sporocytes into the blood. It goes into the human blood, goes to the liver, develops in the liver, and this development of cells then form merocytes. From merocytes, it then releases itself into the bloodstream where it infects red blood cells, and those cells in the red blood cells are known as schistons. It gets to a point where the proliferation of cells in the red blood cells makes the red blood cell burst. When they burst open, a lot of these sporocytes again are produced into the bloodstream, and this stimulates the immune system to produce chemicals that causes increase in temperature, causing fever, headache, muscle pain, causing shivering and all the other symptoms which you see in malaria. And this occurs in a cyclical fashion. So there are points when the patient presents with the fever, and then there are points when the patient then begins to sweat profusely and then temperature comes down. When every red blood cell lyses, when they are destroyed and when they produce more malaria parasites into the bloodstream, there is increase in temperature again due to the immune response, and so on and so forth, and then it happens this way. So several other complications which may result from malaria infection will include affection of the brain and the spinal cord, central nervous system, affection of the brain which causes cerebral malaria. Then there would be affection of the kidney, which can cause kidney failure on the long run. And then there would also be affection of the overall system of the liver. There is enlargement of the liver, there is enlargement of the spleen because there is infection of these organs. There would also be anemia. Some patients can present with anemia because this malaria parasite destroys red blood cells during its life cycle as it's multiplies in red blood cells and destroys them. It causes a low red blood cell count. And due to the destruction of red blood cells, jaundice may appear. Jaundice is the yellowing discoloration of the skin, which may occur in some patients. And you would also see yellowing of the eye. And this is because of some pigment which is produced from the destruction of red blood cells, known as bilirubin. So it could also go ahead to infect the blood vessels and cause inflammation of the blood vessels, most especially the veins, causing thrombophlebitis. Because of the inflammation, blood cells stick to blood vessels, obstruct blood flow, and form a clot there, and then this is known as thrombophlebitis. So it could also go ahead to infect bone and infect various other organs, and that I'm not going to go too deep into. This is just the pathogenicity, the disease process of malaria itself. So due to all these facts, it's important to identify the symptoms that occur in malaria and to initiate prompt treatment. The two forms of malaria which can remain dormant in a person without showing any symptoms, even after the person has been treated from the blood form of Plasmodium falciparum, include Plasmodium vivax and Plasmodium ovale. These two forms of malaria can stay in the tissue like the liver, and they would not form any kind of symptoms, and they can stay there for 6 months to 1 year, only to resurface some years later. So that is why it is important to treat against the tissue form of malaria and the blood form of malaria, such as falciparum. So in other words, there are different treatment regimens for these forms. And some people who travel to malaria endemic regions, such as the tropical and subtropical regions, may treat themselves for the blood form of malaria when they've been infected, but may have the tissue form lying dormant in their system, in their tissues. And when they leave this place back to their respective countries like Europe or Northern America, for example, they may resurface with malaria infection. And this is how malaria spreads in other parts of the world. So it's very important to have prophylaxis against malaria before traveling to a place known to have malaria. At least you begin treatment 1 week before going to a malaria endemic region, and then 6 weeks after you leave, you also maintain treatment. And some of the anti-malarial medications include quinine, chloroquine, primaquine, mefloquine, doxycycline, and just to name a few. And there have been reports that actually show that Plasmodium falciparum in some areas is resistant to chloroquine, and in this case quinine can be used. Quinine can also be used for the treatment of cerebral malaria, and so we can also use antimetal lumefantrine. We can also use the rest of the other drugs which have been mentioned before. Quinine should actually be administered cautiously because it could affect the heart. So proper electrocardiographic monitoring should be checked on patients receiving quinine. So in order to prevent malaria, it's very, very important to make sure we maintain very good hygienic standards, and very important to keep environment clean, use insecticide treated nets, use mosquito repellents on the skin or sprays, insecticides in the house, and it's very important to get rid of all stagnant water, and very, very important also to add oil over stagnant water if we can't get rid of them. So these are just the little measures we can take to protect ourselves against malaria. So thank you very much and have a great day.